Well, good morning, everybody. I hope everyone is doing well. I know today we are planning on talking about chronic sinusitis, and we certainly will do that. Real briefly, let me just take a minute to comment on the most recent Omicron wave because although I am seeing veterans, I still work in the emergency department. I'm board certified in emergency medicine. I still practice in emergency medicine and work in the emergency department, and I am seeing a lot of COVID. Let me take a minute to reassure you that as of today, we're what, 3, 4 weeks into this. I have not admitted a single person with COVID. Everyone that I'm seeing with COVID is getting to go home. Now, I'm admitting people who have heart failure and who have uncontrollable diabetes and who have other medical problems that happen to be having COVID, but the COVID is not the reason that they're getting admitted. So please take that as a reassurance that this is highly contagious. All the studies are showing that, but it's not nearly as deadly, at least yet. It's not nearly as deadly as what we have seen from previous waves. Obviously, if you're worried, I want you to follow up with your primary doctor. If you feel like your symptoms are getting out of hand, go to the emergency room. I just wanted to take a brief minute to let you know I'm not seeing the same devastation with this round of COVID that I have in the past. And that's encouraging. That doesn't mean it's less frustrating, right? But I do want to take a time to just encourage everyone. It does seem like this is less devastating, albeit more contagious. And so please just know that I'm seeing patients do much better with this. And now that is in my practice in one section of Texas. So there certainly is the potential for people to not do well. So I just want sort of give you my perspective. Take it for what it is. Hopefully it's encouraging to you to let you know that, hey, people are doing better this round. That's what I'm seeing. But like I said, if you have risk factors, if you're concerned, I certainly do want you to see your private physician. If you start getting, super short of breath, please go to the emergency room. But sorry, I just wanted to take a couple minutes to go over that. Now we're going to delve into chronic sinusitis because I know that's why you signed on. So chronic sinusitis, inflammatory disease of the paranasal and the nasal sinuses. It's just like it sounds. The chronicity greater than 12 weeks. So if you've been having symptoms, and these symptoms may have some fancy terms around them, but the gist of it is you've got inflammatory aspect of the sinuses that's been going on for 12 weeks or more. And this is interesting. It actually usually kind of presents in young adults, late teens, young adults, and then progresses from there. And it also is more commonly affects women for whatever reason. And typically there are 4 symptoms. You may have 1, 2, 3, but in order to qualify for the diagnosis, you're going to have 2 of these 4 symptoms. Okay. So the 4 symptoms are these: anterior, so in the front, or posterior in the back, nasal mucopurulent drainage. So just snot, right? Dirty stuff that's coming out of the front or going down the back in the throat. Nasal congestion, obstruction, blockage. So it's like, I'm just stopped up. That's the second. You're congested. The third, facial pressure or pain. And that's going to be kind of like right in here. Primarily, you may a little bit back towards in the ears. It's all kind of connected, but really right in here is where you're going to feel it. And then fourth, potential loss of the sense of smell. So those are the 4 things. You've got the anterior, posterior, nasal mucopurulent drainage. You've got some sort of nasal obstruction or congestion. You've got facial pressure, pain, or even a sense of fullness. And then fourthly, a reduction in the sense of smell. Now, these symptoms are persistent. Like I said, they start in the youth, young adulthood, and then they progress. And a lot of times, when you're 20, you don't necessarily pay much attention to it. And then, of course, over the course of 5, 10, 20 years, it just kind of continues on. The inflammation doesn't get better, it gets worse. So you can have times during that during this chronic period where it acutely flares. So You have your sort of baseline fullness, pressure, drainage. You don't think much of it. And then all of a sudden it's like way worse, a lot more pressure. You're getting a lot more drainage. All of a sudden you can't smell or you don't. So you can have acute flares on the chronic. Typically though, you don't have fever. So that's good. And typically patients do respond in those acute flares to some symptomatic treatments. Now, risk factors. People who have any asthma, allergic rhinitis. If you're around irritants and pollutants, depending on your line of work, you may be exposed to that more than others. If you have some immunodeficiency or even viral infections, dental infections, and then mold, indoor dampness, those kinds of things. All of those sort of risk factors will exacerbate the likelihood that you could have a sinusitis. Often it can become chronic. So you do want to kind of pay attention to any of those risk factors. Now, we talked about this. You need 2 of the 4 cardinal signs or symptoms that we discussed: the anterior and the posterior mucopurulent drainage, the nasal congestion or obstruction or the blockage, the facial pressure or pain or fullness, and then the loss or reduction in the sense of smell. You got to have 2 of the 4 of those symptoms to be considered for chronic sinusitis. The other incredibly important component is objective data. Now, this, unfortunately, I'm not able to do over telemedicine. And what I mean by that is in order to confirm this diagnosis, I need a CT scan that is going to show evidence of that mucosal inflammation. Or you could go to an ear, nose, and throat specialist, and they can do an endoscopic exam where they actually look up your nasal cavity into the sinuses with a fiber optic camera and see visibly, is there any inflammation? But one of those 2 things has got to happen in order for that objective data to be met, along with the 2 out of the 4 cardinal signs and symptoms. And that's where it gets tough, because if you come and I'm presenting this data and I'm like, yep, you've got, 4 out of the 4, 2 out of the 4, 3 out of the 4. But then you don't have the objective data. We can't confirm that the chronic sinusitis is the case. Back to what I was saying earlier, working in the ER, I get head CTs quite frequently for various reasons. And you can see chronic sinusitis. I probably once a week see it. So it is very easy, and it's not like you're going to miss it if that's there. Okay, so that's good. But that is something that I do think is important. That in addition to the symptoms, you are going to need to have an objective data, and you can get that through your primary physician. If you have an ear, nose, and throat physician that is doing that, you can certainly do that. And as far as treatment options, again, I would always encourage you to talk to your primary physician or your primary specialist before you do that. But there's not really a cure for chronic sinusitis, but you can treat the symptoms. And the symptoms have historically been treated with things like nasal saline or nasal corticosteroids, even oral corticosteroids, perhaps, antibiotics if there's an infectious component, anti-leukotrienes. So these are all treatment modalities that are available to help with symptoms. Certainly if there is an infectious component, the antibiotics, but of course, talk to your primary physician or your ear, nose, and throat specialist before you start taking any of those medicines. But the most important thing are the 4 signs and symptoms we talked about. You need 2 of them, plus either a CT scan confirming chronic sinusitis or an endoscopic exam performed by an ear, nose, and throat specialist that confirms the mucosal inflammation that's been there for greater than 12 weeks. So hopefully this gives you a little bit of an overview of chronic sinusitis, what symptoms you can expect to experience, what risk factors you might have, like asthma being one, exposure to irritants and pollens like we talked about. And then, of course, if you've been around mold for a long time or anything like that. And then certainly any treatment modalities that your primary physician or primary specialist approves. But hopefully that gives you a little bit of an overview of chronic sinusitis. I know that a lot of people probably just sort of live with it and don't think much about it because it's been going on for a long time. But that is something that we see plenty of in terms of the chronic sinusitis. And like I said, you can have flares and you can have acute on chronic sinusitis. That is common. And oftentimes that's when I end up treating it, is when it gets more acute. But there is a baseline that's present that can be equally debilitating. I mean, it can be one of those things that you've learned to cope with, but it doesn't mean it's making things easier. So that's pretty much it for now. I know there are probably questions, and I'm happy to answer the questions. But the important thing I wanted everyone to take away from this was what we're looking for in terms of the signs and symptoms to establish a diagnosis. So the anterior and the posterior nasal drainage, the mucopurulent, which is just that dirty yellowy snot. It can be in the front, it can be in the back. The nasal congestion or obstruction is the second one. The facial fullness, pressure, pain, again, right here is where you would most primarily feel it. And then lastly, the loss of sense and smell. So those are the four that we are looking for. The duration, 12 weeks or greater. So if this has been going on for 3 months or more, then that makes sense, especially coupled with this. The third piece of the puzzle that tends to be the most difficult is just logistic, getting that CT scan that confirms it objectively, or that endoscopic exam that confirms the mucosal inflammation objectively. But that really seals the deal. And that objective data, no one can argue with. The VA can't look and be like, well, did you really lose your? No, it's like, it's right here. Like, this is, it's objective. It shows it in the CT scan. So let me stop. I've been talking a lot, and see if there are any questions, anything that I can help answer, and go from there. Guys, I do appreciate you coming in, logging on, and hopefully this has been helpful for you. So chronic sinusitis can be secondary to things like asthma. It also can be standalone. So in terms of, do I primarily see it as a standalone? I would say yes, probably. Do I also see patients who have other problems that might be associated? I do. But primarily what I'm seeing with chronic sinusitis is more standalone, but it can be secondary. It certainly can be. And that would, we would need to talk more about what other conditions you're struggling with, whether it's asthma or if you have some immunodeficiency. That is something that we certainly would want to explore. But most of what I have seen to date has been a standalone chronic sinusitis. If you've had that's a good question. If you've had chronic sinusitis diagnosed previously in your medical records, then you shouldn't need to go get another CT scan or objective data. That having been said, if the diagnosis of chronic sinusitis was established in your previous records without imaging and objective data, that could potentially be a problem. Not sure how they would handle that when they're reviewing that, because it's already been diagnosed. So for me, it's like, okay, yeah, you've had this. This is what you've been going with. You've got I guess the best thing to say is that if you've never had objective data, even if you've had the previous diagnosis, it's going to strengthen your case if you have that objective data. That's really the bottom line. Is it's just going to strengthen your case. But if you've had it in your previous diagnosis, especially if the VA's already acknowledged it, well, then you've got it. So hopefully that answers the question. Not necessarily. Okay, so sorry. So the question is, if you normally get a sinus infection a couple times a year, is that the same as chronic sinusitis? Not necessarily. So the chronic sinusitis is going to be something that's sort of persistent over time. And like I said, that 12 weeks is that magic number, that 3-month period. But if you're just getting sinus flares once or twice a year, and then everything kind of goes back to normal, and you're not having those symptoms of drainage in the front of the back, or the symptoms of facial pain and pressure, or the reduced sense of smell, or the nasal congestion feeling, then no, I wouldn't say it's the same, because you want those. You've got to have 2 of those 4 criteria symptoms in order to have chronic sinusitis. And if you have a sinus infection that then gets resolved with treatment and you go back to normal, then I would say that no, sinus infection, even twice a year, would not be the same as chronic sinusitis. Hopefully that helps. How does this condition differ from ongoing allergies? Very good question, because there is a lot of overlap, especially if you live in a place that has a high pollen count, or you've been struggling with allergies for years. They can certainly overlap in terms of the nasal discharge and drainage. And that's where, and this is actually not only a good question because of the similarity, but also increases the importance of that objective data. Because if you have ongoing allergies, you're not going to have mucosal inflammation that's going to show up on a CT scan or an endoscopic fiber optic exam that the ear, nose, and throat doctor is going to do. So that's where that objective data comes in. It becomes very important in helping us differentiate: are we dealing with allergies, or are we dealing with a chronic sinusitis? Because they are 2 different things, but those symptoms can overlap. So it's a very good question. Thank you. So if you want to interview with me or anyone on our team to see if you've got a diagnosis of chronic sinusitis, I would reach out to Telemedica, and I know that we can put that information, there we go, and see about getting set up with an appointment, and we will have an interview. And I usually tell people it's almost exactly like going to the doctor's office, except you sit in your own room or your own car or wherever, and we talk. I ask you a handful of questions. It doesn't take too long, 10, 15 minutes. And then I'll let you ask me some questions and we kind of go from there. But this information at the bottom of the screen is the absolute best way to get in touch with Telemedica, so that you can get set up to get an appointment to see me or someone on my team to kind of help you figure out, do you have chronic sinusitis, or is this more of an allergy type picture? Because that is something, that you can get treatment for allergies too, just as much as you can chronic sinusitis. So the email address and phone number at the bottom is a great way to get started. So I'm not seeing any more questions, which hopefully that's a good thing. Hopefully I've been clear on what we needed to establish in terms of the 4 cardinal signs and symptoms, with the objective imaging that we need as well to establish the diagnosis. We're going to post an informational flyer, as it were, a summary of all of this information that we talked about. Certainly don't hesitate to reach out with questions. We're happy to answer that. And then, of course, like I said, before starting any medications, check with your primary doctor. That's always the safest thing to do. So, but we will post that, so you'll have that information as a resource. And we look forward to helping anybody that we can. And please don't hesitate to reach out to Telemedica if you want to set up an appointment to see me or anyone on my team. So thanks so much, guys. I appreciate it. You'll have a great day. Stay safe. Be encouraged. I'm seeing good things out there. Okay.